as an emergency medicine physician and also as medical director of LifeFlight of Maine and medical director of the Transfer Center, I know full well and intimately that which you do. And in fact, when you think of intimacy, you have an entree to intimacy as a healthcare provider, shared only by the clergy perhaps, and that is recognized as so important by society. You help leverage the creativity of every physician, every nurse, every PA in the entire healthcare system. You're part of and a very fundamental component of the tapestry of healthcare that we have in Maine. It's critically important. I think it's also important to reflect for a moment upon distance. We are asked to have physical distance between each other. We wear PPE in order to distance ourselves from the coronavirus. We have to distance ourselves, in fact, from our spouses and from our children when we come home. And our colleagues at work, we also have to maintain physical distance. But I think it's important that we not maintain distance from our inner feelings and not maintain distance from those who would help us get through this very perilous time. And so I would urge each one of us to remain extremely sentient of our own feelings and share those feelings, especially the ones that, as you know, sometimes are those of despair. And share those with our spouses, our loved ones, and most of all with ourselves. Recognizing as well that while society may call us heroes, there are limits to heroism, and particularly to the sustainability of heroism day in and day out. Particularly as EMS professionals, we're now called upon to be the family that in some cases is distanced from the very patient who holds them so dear. We then are the people whose hand they touch, and it is our face, perhaps, the last that they feel. May we always be worthy of the sanctity of that moment and the trust, and celebrate this small distance between ourselves and the humanity of all mankind. Thank you.